Hey, so man, how's it going? Hey, you okay?
Good, bro.
Hey, what you eating right now?
I think something's wrong.
Are you allergic to peanut butter? Here, I'm call 911. Okay?
I can't breathe.
Hello? Yes. Is it okay if you send an ambulance to 1901 Fowler Avenue? Our buddy, I think he ate peanut butter and he's having an allergic reaction. No, he's not doing too good. He's wheezing. Alright, please come right away. Thank you.
This is dispatch calling ambulance 152. An allergic reaction incident happening to a male, unknown age, at 1901 Fowler Avenue. Please send. Immediate.
Copy that, dispatch. This is ambulance 152. We're en route and ETA is 2 minutes.
Let's go.
Okay. For PPE, we have our gloves. The scene appears to be safe. LOI seems to be a allergic reaction. There's one patient and no suspected. He's fine.
Okay, I'm EMT Jiaming. I'm here to help. What's the problem right now?
My buddy Kai, I remember he told me that he had peanut butter. He's allergic to peanut butter like a long time ago, but I think he accidentally ate it.
Okay, so right now I can see the patient seems to be in respiratory distress and with labor breathing, with numerous hives on his forearm, on his hand, and is currently in tripod position. All right, sir, what's your name? Hi, can you track my finger with your eyes? All right. Patient is A/O times 4. Patient's chief complaint seems to be respiratory distress, acute. All right, as I can see, my patient is not having any major sign of major bleeding. The patient's airway is patent because he can speak in 1 to 2 word sentences. Now my partner is going to put him on a non-rebreathing mask. And now I'm going to also play this. Bilateral wheezing at both sides, and now I'm going to assess the patient's pulse bilaterally. Alright. I'm going to assess his pulse at his radial. The patient's pulse is weak and regular bilaterally. As I can see, his skin condition is pale, cool, diaphoretic. Alright, my patient seems to having a severe allergic reaction. Hey sir, is it okay if we give you a dose of epi? Alright. Okay. Alright, I'm going to check my 6 R's before I administrate this epinephrine. My 6 R is right patient, right dosage, which is 0.3 milligram, and at the right time, at the right route, intravesicular, and the right medication, epinephrine, and the right documentation. So first of all, I'm going to assess between his knee and his hip and find the midpoint between it. That is right here. And then I'm going to sanitize it before I poke it. Okay. I'm going to remove the cap and press firmly against the location I'm going to administrate. And press firmly 1,000, 2,000, 3,000. And remove it and quickly dispose this at the sharp container and rub the area for 10 seconds.
Alrighty, now we're going to be transporting the patient as priority 1 in the Fowler's position and throw a blanket over him to treat for anaphylactic shock. Alright, sir. So signs and symptoms obviously include shortness of breath with bilateral wheezing. Do you have any allergies, sir?
This is peanut butter.
Peanut butter, okay. And are you taking any medications for that?
I got an EpiPen that I use. I just didn't have it with me.
Okay. And then do you have any past medical history, like any other allergic reactions in the past or anything like that, or no?
No, just when I first found out I had peanut butter allergies.
Okay. What was your last oral intake? Was it that peanut butter you had?
Yes, sir.
Cool. Okay. And then what were you doing before you ate that? Just hanging around?
Yeah, just hanging around. Just got done with work.
Okay. Cool. So do you feel better right now, or is it worse?
No, I feel pretty good now.
Okay. Where does it hurt anywhere? Like a region where it hurts in the chest anywhere? Front, back?
No, it did a little in the front a little bit, but it was going away.
What would you rate it 1 through 10?
Right now, probably about a 2.
Okay. And then when you had the last oral intake, when did it start after that?
Probably about 2-3 minutes after.
All right. Cool. We'll be doing a reassessment every 5 minutes for this TAP patient. If the level of consciousness does get worse, I'm going to treat for shock, and if he does code, I'm going to have everything on standby. The patient does feel better en route, so I'm going to take vitals now. So that's your left arm.
Yeah, like I teach you. Yeah, this is like that. Well, the medical certifications. I was talking about the one that is like basically they told me to anything that get a job. And you could do most of it. Every the guys take the one together and they're really fishing careers. That's what I'm trying to
Okay, your blood pressure is 100/85. I'm gonna take your pulse, okay? Heart rate is 95.
I might stay another year now because
And respirations are 16.
This is ambulance 152. We're currently en route. ETA 5 minutes to the ED. The patient is currently doing better en route, and we gave him 0.3 milligram of epinephrine and placed him in a fallow position with non-breathing mask. The patient was experiencing anaphylactic shock and allergic reaction from peanut butter intake.
Anaphylaxis is when the body overreacts to an allergen, releasing histamines that cause high swelling and trouble breathing for the patient. When we gave the patient 0.3 milligrams of Epi, the Epi opens the airway, raises the blood pressure, and reduces swelling.
This is dispatch calling ambulance 152. Priority 2, a male incident, or, oh, I messed up.